things over to Chairman Christopher Cohilas. We're certainly joined today by representatives from Phoebe Putney Memorial Hospital as well as Department of Public Health. And we'll get right into it, and I'll turn proceedings over to the Chairman. Chairman Cohilas.
Good morning, everyone. We are moving through this process, which is obviously a very important process. First of all, I want to thank all the members of our task force that are working with respect to COVID-19, the coronavirus, which has, as we announced yesterday, has a very significant presence in Dougherty County. We know that as a fact, and I want to dispel any rumors, myths, legends that are being conveyed or purveyed by anyone in the community that this is not a significant issue. It is a significant issue, and I say this standing here as the chairman of the Dougherty County Commission and also with direct responsibility for emergency management in this community. We saw several days ago the emergence of this trend in our community. That is why we took immediate and swift action to go ahead and declare a state of emergency, to go ahead and form a task force, to go ahead and bring all the collaborative partners that we needed to have together in order to be able to best respond to our citizens' needs and make sure that they knew, understood, and appreciated how significant this issue is. We now know, beyond a shadow of a doubt, that we have had a proliferation of COVID-19 and the coronavirus that has been very significant in our community. We know that our community is one of the communities that probably has one of the largest presences of the coronavirus in the state. I say that, and I say that not to cause panic or alarm, but rather to raise our vigilance. We have worked very collaboratively within the Emergency Management Agency, have obtained a lot of witness updates, a lot of firsthand updates from families. We have been able to track certain trends, and one of the things I'm going to turn to here in a second is providing information specifically with respect to those that we have been able to identify because of their interactions with certain entities or certain events that may have been put at risk or exposure to the coronavirus. We know that there is a trend with respect to two separate events that occurred in our community, that being two separate funerals where there was the presence of two separate churches, where we understand from firsthand knowledge from the people that were there and that have been kind enough to share information with us that they have been exposed and that they've had family members or other people in their within their sphere of influence that have become infected with the coronavirus. So I say all of that to say this. We've identified two separate funerals that occurred within the past several weeks that appear to be, and we have significant evidence to suggest that the coronavirus was spread at these funerals. And I say this, and I don't say this lightly, and I want to make sure that I'm very, very clear. This is not to besmirch anyone's reputation, any entity's reputation. This is simply, funerals are social gatherings, and they are places where this disease process absolutely can proliferate. It is an easy environment for it to infect people, where you're hugging each other, touching each other, emoting, just like human beings that are going through a grieving process, which is precisely what happened in these two instances. And we had two of our very beloved churches here in this community that had a very high presence at these two separate funerals. And so we've identified a funeral of a gentleman named Johnny Carter, who was a gentleman that had, his funeral was here in this community, and also the funeral of Andrew Jerome Mitchell. We know that those two funerals were heavily attended by members from Gethsemane Baptist Church, as well as New Direction Baptist Church. And we know that from speaking with these people, some of the folks that were at these funerals were infected with the virus. And we also know that there's a commonality with respect to M.L. King Funeral Home and the people that had interactions with that entity that they have become infected with the coronavirus. I say all of that to say this. If you're a member of Gethsemane Baptist Church, if you're a member of New Direction Baptist Church, if you've had interactions with M.L. King Funeral Home, I'm not saying these things in order to cause panic. Rather, what I am saying, suggesting, and trying to implore the community with respect to is this. If you are symptomatic and you have a connection to one of these entities, or you've had interactions with folks that are in these entities that you know do have the virus or have symptoms of the virus, then please take appropriate caution. If you do have symptoms, step one, call your primary care physician. Talk with them. If you don't have a primary care physician, Phoebe, who's one of our fantastic partners, has set up a COVID hotline, 229-312-1919. We ask you, if you are symptomatic, to call this number. And I want to explain to everyone what will happen when you call this number. There are a limited number of tests in our community. There are a limited number of tests in the country, in the world. We have been fortunate enough to be able to be out in front of this thing so as to be able to obtain a significant number of tests for our community. However, it is not an infinite number of tests, and we have to be very judicious in who does receive those tests, and that's being directed by our healthcare professionals, by the public health department. So when you do call this number, they have trained professionals that will go through a list of questions where they will determine whether or not you are screened in or screened out, and whether or not you should or should not receive one of those tests. If you are screened in, they will set up an appointment for you to go to a site so that you can actually be administered the test and done so in a safe fashion, and so that you can receive appropriate follow-up care afterwards. This is a virus, and as our healthcare professionals will tell you, there's not a medicine that a shot that you give folks that makes it go away. Rather, it's something that has to work its way through someone's body, and we know that there are components of our population that are particularly susceptible: people with respiratory disease, people with high blood pressure, hypertension, people that are elderly, people that are smokers, are at greater risk from suffering from some of the more horrible harms that can come from this horrible disease process. But we do know and are encouraged by the fact that our community, and by virtue of being part of the United States and the state, we have good health care in this community, and we've seen a very low morbidity rate. We want to keep it that way. We also want to make sure that we don't proliferate this disease to the point that it creates a run on resources that is untenable for our community. I want everyone to be thoughtful and think about what you do, who you interact with. The term social distancing is not a buzzword. It's not something to be mocked or made fun of. It is real. When you walk into a room and you breathe the same air as someone with the coronavirus, you quite likely can obtain those germs and become infected with the virus. It is very, very simple. Shaking hands, kissing, touching, hugging. You need to limit those things. You need to limit who you interact with. Stay away from gatherings of 10 or more people. I've been very thankful to hear of the high level of cooperation that we have had from our clergy in this community, and I recognize that it is very counterintuitive in a time of need to not want to gather and spend time in worship. And what I would just encourage everyone to do is take that time to worship and pray within your own home, with your own family, and not to gather in large groups, because we know beyond a shadow of a doubt that this disease process does proliferate in large gatherings, and all it takes is one sneeze to infect an entire room, and for everybody in that room to then go and sneeze somewhere else after they've adopted that disease process to go and infect many, many, many more people. And so it has an exponential effect in a community, and what we want to do is make sure that the resources that we have gained, that we have fought for, that we have advocated for, that many other communities do not have, because we have been organized, we have been collaborative, we have been cooperative in making sure that we got those resources. We want to make sure that those resources are used judiciously to best effect the best process, the best recovery for our community as a whole. I say this in just knowing the numbers that we see, and I'm gonna say this to y'all: the numbers are going to go up. They are absolutely going to go up. And while I'm not a doctor, I'm not a public health professional, I certainly have spent enough time, I've spent enough time learning about this process, making myself aware of it, and understanding how it proliferates. We're going to see some numbers that are very significant in Dougherty County in comparison to the rest of the state. And all it takes is social gatherings, and I want to say this: no one did anything wrong by going to any of these funerals. It is just an example of how this disease process can literally infect our community. And right now, we need to draw upon the vigilance that we utilized in 2017 and 2018 in overcoming disasters of different types. We need to be thoughtful. We need to be checking on our elderly. We need to make sure that people that are working with our elderly have not been exposed to the virus. That is very, very, very important. If you fall into one of these categories where you know that it is likely that you have been infected with the virus or you are symptomatic, take some time to pause, think, and consider your actions before you go and expose other people and other folks who are likely more vulnerable than you to these germs. That is our duty as citizens, that is our duty as Christians, that is our duty as members of this community, to think of others before we take actions. Wash your hands. Be vigilant, be clean. All of the things that you learned from mom and dad when you were a kid. It's just good common sense. Don't touch things and don't touch people unnecessarily. And I recognize that we are all social creatures. We all crave human interaction, but we don't need to be interacting unnecessarily. We need to take to heart the recommendations that have been given to us by our healthcare professionals, and that's very, very, very important. So with that being said, I'm going to turn things over to Phoebe CEO Scott Steiner for an update. Thank you.
Good morning, everyone. Thank you, Chairman Kohelas. We're blessed with a great partnership, not only with the with Dougherty County leadership, but with also the City of Albany. It's because of that we will get through this and get through it together. Just as Chairman Kohelas mentioned, this is one available resource. We stood this up yesterday, pretty quick, worked on it all weekend. The process, at one point we had 15 nurses answering the phone yesterday. We did field over 350 calls yesterday, with 78 people being asked to go to a drive-through screening site. So we've completed those, and we'll be doing that every day. As of just when we left just a little bit ago, we have had no new test results in. I know that is frustrating to everyone in the community. We are working with our laboratory, which is LabCorp. This is not something that we can test for internally, and we're also partnering with Quest Laboratories, who have come online with that ability to test. So we anticipate getting test results in today and having more information for you tomorrow. I'll turn it over to Dr. Kitchen and Dr. Black. Happy to answer any questions at the end.
Thanks, Scott. Just to provide an update, what I can share with you, compared to our report and our press conference from yesterday, there's really been no significant changes within Phoebe Putney Memorial Hospital compared to yesterday. As Mr. Steiner alluded to, we have had no additional test results that have been made available to us from LabCorp since we spoke to you yesterday. And, I know that can be frustrating on a number of fronts. It's frustrating for patients. It is frustrating for our providers and our physicians. And we have been in conversations with LabCorp, and I think certainly their resources and capabilities are probably also being stretched as well. Currently, in terms of the laboratory testing, there have been two options thus far. One has been through the State Department of Public Health lab in Atlanta. The other has been through a commercial lab called LabCorp. LabCorp came online last week, and so we began submitting samples to them as well. As Mr. Steiner alluded to, Quest Lab, which is also a large national commercial lab, was testing on the West Coast last week, but we became aware early this week that they were going to have testing capability as well. And so we're pursuing that as an option because, unquestionably what we want are that test results that can be both accurate and readily available as well. But I do anticipate that we're going to have an update probably in the very near future. As Chairman Kohelas alluded to, I fully expect that the number of positive COVID-19 patients in Dougherty County is going to go up, and I have no reason to believe that's going to show any significant change in the foreseeable future at this point. We are working with a highly contagious, easily communicable disease that is transmitted by person to person. And in terms of the statements that Chairman Kohelas had, the question you may have is, how was this uncovered? And what I can tell you, as part of prudent medical history taking on the part of our physicians, knowing that this is a highly communicable disease, knowing that it can be easily related to travel and that sort of thing, when they were doing their medical history taking, I think we quickly recognized that it was very suggestive of certain pockets or clusters of transmission within our community. And so we certainly have a responsibility, when that's recognized as being the case, is to reach out to the State Department of Public Health and the epidemiologists who truly have the training and the education when we suspect that there may be pockets of community transmission, to fully investigate that. And so I think what you have seen is that that has been revealed in terms of some of the findings that were shared with you today. Again, I just want to speak to the fact that we are on an ongoing basis in terms of making sure that we have the people and the resources to fully respond to the COVID-19 challenge in our community. I can't overstate the fact how our workforce at large has, I think, really risen to an occasion that truly inspires me. So, Dr. Black,
I don't really have any additional update, but I will share with you some communication I've had with some friends and colleagues from different areas of the country. As Chairman Kohelas and others have alluded to, we have a significant cluster given our size of the community down here. And I'm trying to look at it from a glass half full standpoint. A couple of things you may not know is that we've been planning for things like this for years. We didn't know it would be coronavirus 19, but we knew it would be something. And then when it appeared in China, we stood up and made certain things and said, well, what if it happens here? What are we going to do? And we made certain preparations. And then when it hit our shores, we said, well, this thing is here now. Soon it's going to be in our area, and are we prepared? We put certain things in place. So a lot of the things that you see happening and a lot of the changes you see happening are plans that we've made and contingency plans that we continue to improve upon. We've leveraged our relationships that we've had with people around the state and around the country and even internationally that were dealing with this before we have, and we've learned some good lessons from them and avoided some of the potholes or pitfalls along the way. Now that we've had a pretty significant cluster of cases here, we have people calling us for advice. And so what we're doing here has been recognized both throughout the state and throughout the nation, and people are looking at us for advice. So one of my colleagues, who's from a well-known research triangle, was calling and said, we're looking at your response there, and we're awfully impressed. How much can you share with us about what you're doing and what your plans are going forward, as they're on the front end of their own cluster? And so we're happy to share that information, but it's nice that people are recognizing the preparation that you made as a community and your response. So again, I think that one of the biggest things that you can never take for granted, but we're awfully appreciative of the response and help that we're getting from the community, from people at risk, from patients that are awfully understanding of what not only we're going through locally, but we're going through from a nation. So again, thank you for your continued support, and we'll continue to be very interactive with you, and we're going to get through this. Thank you.
I'd like to offer the opportunity too to Dr. Ruiz to come up for a few comments.
Thank you, Chief. An awful lot has been said about COVID-19. We've read a lot about it, and it can be overwhelming at times, I suppose. But let me boil a lot of this down to three sort of simple rules that I would like everyone to just consider. One is, if you're sick, stay home and consult your healthcare provider. Number two, stay away from everybody else as much as you possibly can. And number three, do what you can to help and support your neighbors in need, while at the same time keeping as much distance as you can physically from them. A lot of us, most of us, have not been directly affected by COVID-19, and that's good. We hope that it will stay that way. A lot of people are cooperating, they're following advice, they're doing what they can to contain this virus. But because so many of us have not been directly affected, I suppose there's a possibility of a false sense of security within some individuals. And so with that in mind, I'd like to say that maybe you aren't directly affected today, but it could be tomorrow that you'll be affected, or the next day, or someone that you love, that you're close to, may be affected. The truth is, we're really all in this together. This is one great big community from coast to coast, and if we will do the right thing, we'll come out of this a whole lot better than if we're just totally irresponsible. Now, I'm with public health. I don't work with Phoebe Putney directly. I'm not on their payroll. I don't work directly with any hospital. But I want to say a word about how important it is to have functioning hospitals in all of our communities. It may not be, as I say, you don't need a hospital today, but you might tomorrow or the next day. And we need to be thinking about what hospitals need as far as their resources. We need to think about the people who are already in the hospitals and how we can protect them, and especially those who work in the hospitals. So we need to follow the rules. We don't want to be carrying viruses into the hospital environment, and we don't want to irresponsibly waste precious resources that the hospital will need to take care of us and those who are already there. So with that in mind, I want to talk about some precious commodities that we would like to have more of. Two categories. One is one we refer to as PPE, personal protection equipment, and the other is these specimen collection kits that we've talked about. As far as personal protection equipment goes, there are some providers and some organizations that have real shortages, and we need those. Some of the good news is that we are expecting a portion of the Strategic National Stockpile to arrive in Daugherty County this morning. And we don't know exactly what will be contained within that shipment, but we're confident that it will be a good boost in the arm for some personal protection equipment that can be used by the medical community. And then the viral transport media kits, those are the little kits that we use to obtain the samples that will be sent off to the laboratories to test for COVID-19. Those are on very short supply. LabCorp is one of the sources that we get those from, and there are some others, but they're on very short supply. So I want to speak especially now to the medical community, whether it be a private physician's office or a clinic or a hospital or any other organization. We recognize that some organizations are providing a collection of these samples to be tested, and we are also aware of the likelihood that some organizations may be experiencing a shortage of the PPE or of the collection kits. Public health believes that we will be able to support these organizations and these practices as far as the PPE is concerned. So what I'm asking is for any organizations or practices that are providing the collection of the specimens, if you're short on some supplies, please call Public Health and let us know. On the other side of the coin, we are short in Public Health on the collection kits. So if there are practitioners in the community that have surplus amounts of the viral transport media kits that you do not intend to use in the near future, likewise, if you would call Public Health and offer them, we'll see to it that those kits are put in the hands of people who are able and willing to use them. So we're sort of functioning as a trading house so that we can share these precious commodities around the community so that we can serve as many people as possible. And the final thing I want to mention is how important it is to keep our distance away from one another. Stay at home if you can. When we get together, it's already been said, but let's say it one more time. When we get together and we spread germs around, we're putting people's lives at stake. Thank you very much.
Just one more thing to follow up. Obviously, at any time, even outside of the occurrence of a pandemic, you're going to have funerals in a community. And as we have seen with the coronavirus, that has been a key way for it to proliferate our community. And so we're going to continue to have funerals that are either associated or not associated with the coronavirus. That's just part of the life and death process that happens in any community, that happens every single day. But the current protocols that are out there recommend that we keep our distance from each other and consider perhaps only doing graveside services. And I say that I say that with caution. I say that with understanding how hard this process is for everyone. Everyone wants to grieve. Everyone wants to have connection to another human being, to loved ones, to family members during the mourning of one's death. And I say that just, and I recognize how hard that is to ask people in a community to do that, but understand that short-term emotional sacrifice can actually provide the investment for long-term recovery for an entire community. So I thank you very much, and I'm going to turn things back over to the chief.
What I'd like to do at this point is open up for questions you may have for our panel. Please.
Can you give us the name of the churches again?
Sure. Gethsemane Baptist Church and New Direction Baptist Church.
Okay. Also, what numbers are reported to the state? Are they the presumptive cases or are they confirmed cases?
Those are only confirmed.
Okay. And how long should we be practicing social distancing?
Until further notice.
So Phoebe's doing something for employees for healthcare, but is the county providing any assistance to people who still have to work but have children who aren't in schools?
Yes, we are.
What regarding?
Yesterday, the county commission passed a policy. It is a coronavirus response policy that gives our department managers and our organization the ability to support our staff and their families and the community at large to be able to stay home, work from home, and not have their leave time impacted. The county will pay up to 3 weeks for our employees to stay home and deal with any symptoms, or if they happen to test positive, to get through the healing process and to return to work. We have closed our HR department. It's totally online now. You can't physically go. And we're looking at also making other changes in other departments to minimize contact, face-to-face contact. And so we're continuing to monitor this situation, and we will keep the public advised as we make decisions real time.
So is this just something for county, people who live in the county, or is this for the whole community?
This is county employees.
Is there anything taking place for people who, like just the community?
I'm sorry, I don't.
Like, let's just say you worked at a store and you still have to work at the store, but your kids are not in school.
I can't answer that question.
There may be some services through DFACS or some of the other social services. I'm not sure of that. Obviously, those are good questions to pose to those different social agencies.
Okay, and then my last question is, how many people can be quarantined at a time at Phoebe?
So, you know, there's no specific number there, right? We've got a certain number of beds. We are making plans for not only what we have today in the hospital and that we're awaiting results on. Of course, everyone in Phoebe isn't there because of COVID-19. We have many other patients that are having procedures or in accidents, have other illnesses. So we are making plans today. We're trying to predict what the volume could be by day and by week, so we can stay one step ahead of that. And that's what I tell you is today we're fine. If you could tell me how many patients we're going to have by the end of the week, I could tell you how we would. It's just every day is a new day, so we're planning for what we've seen and predicting that forward and making appropriate plans.
So yesterday they said it was around 50, there were 99 tests.
Correct.
And then there were around 50 people who were in the hospital and around 30 who were in home self-quarantine.
That's correct.
Why were those 50 in the hospital and why did the other 30?
Yeah, so it's just based on their acuity. It could be related to their vital signs. You know, Dr. Kitchen, you want to let the doctor tell you more about the condition.
So, you know, regardless of whether the patient is exhibiting symptoms of COVID-19 or not, you know, with every patient, you know, we go through the decision-making process. What's going to be the most appropriate level of care? That may be at home. It may be on one of the inpatient medical units. It may be in our intensive care unit. So what I will tell you, that's really a medical decision-making question that's put into the hands of the physicians and our providers. What I spoke to yesterday is over the weekend, what we did, we made plans to basically cohort or take one of our inpatient medical units and specify that as for patients who were either testing positive for COVID-19 or who were awaiting the results of that. Similarly, we took one of our 3 intensive care units at Phoebe, Maine, and did the same thing. You know, that was solely intended, again, looking at the transmissibility of this virus, taking prudent states to try to physically cohort those patients in specific areas of the hospital. The other thing that went into that decision-making process is that if you have the resources to do so, to put those patients in what's called a negative pressure room, which has a significant impact on decreasing the amount of the transmissibility of the virus within that room. So we actually designated the nursing unit that has the most negative pressure rooms and decided that would be the most logical place to cohort those patients. But at the same time, we have to be prepared, you know, 2, 3, 4 steps ahead. So what I'm saying is every day we sit down and we say, okay, if we exceed our capacity on this nursing unit, what's going to be the next step? And so I think we've had a very methodical and a very measured approach towards that.
I want to give more of a precise update on those. You asked for the names of those 2 churches, and to give the precise names, it's Gethsemane Worship Center and New Direction Christian Church, and also the M.L. King Funeral Home. So Gethsemane Worship Center and New Direction Christian Church.
I got one question, I promise the last one. Where are the tests coming from, and is there like a limited supply? Are they coming from Atlanta?
Where are the test kits coming from?
The test kits for the viral specimens, ours have been ordered primarily through LabCorp. And we ordered 1,000 and last week, and we're hopeful that we'll be getting in 100, possibly today or tomorrow. We also are, our state public health office has also reached out to try to get some of those collection kits for the entire state through public health. And it sounds promising that we may get some through the state public health office also.
Gotcha. I guess I got a question next. So the patients who go through the testing process, during that process where the results aren't in right now, because we know that as soon as they get tested, the results aren't you don't know for that quick second. Is there a holding place? Do you guys have to like go home, don't talk to anyone? Because, for example, if a random person gets tested and then they don't know their results right then and there, then they go like to the movies. Like, how is that procedure, that process handled?
Very good question, and I'm going to start by kind of recapping how we like this to proceed, okay? Well, let me just talk a little about COVID-19. There's a very good chance that many in this room have been exposed to it. The vast majority of people that actually have been exposed to coronavirus 19 or have been infected by it show little to no symptoms. You may have no symptoms, you may have a common cold. When you're evaluated either by the screening process initially, we'll determine whether or not you're at sufficient risk, either because of places you may have been where we know there's a cluster, or because of comorbid conditions that would make you more susceptible. If you have that combination and you're exhibiting certain symptoms like extreme shortness of breath, then we would allocate a test and probably put you in the hospital. If you're showing little to no symptoms, we would probably tell you to monitor yourself, monitor your temperature, and notify us or notify your primary care physician if you have any symptoms. So the decision to be put in the hospital is not based on whether or not we test you. It's all based on how sick you are and whether or not you're suffering from significant suffering from symptoms. So you may well be in the hospital with a negative test but extremely short of breath, or you may be at home with a test that's pending and it may come back positive, but as long as you're feeling well, there's no need for you to put you in the hospital. But the procedure is still the same for everyone, and that is social distancing. You mentioned going to the movies. We recommend that you not go to the movies. You're going to be closely cohorted with 100 other people in the same theater, laughing and joking and slinging stuff from your mouth and nose as you laugh, and people in close proximity. So the social distancing, it pertains to movie theaters, small gatherings, parties at home, and along with that, we don't think social distancing means get in your car and go to a resort. You know, our cluster of cases seems to have been centered around a young man visiting from out of the area and came to our area. So diseases will travel, and so if you travel, so would they. So the social distancing means pretty much staying close to home, isolating yourself as much as you can from inside your house, and minimizing your contact with others as much as you can. There's a great resource on the CDC website, cdc.gov, and if you will put in coronavirus 19, there's some information that's intended for the everyday citizen to read and gives advice on how best to achieve social distancing and isolation, especially while you're monitoring if you're waiting on the test results. But it gives you certain strategies, tells you how to clean with flat surfaces, and things you can do to help minimize the person-to-person transmission. So again, I just want to reiterate, you won't get a test necessarily because you're worried or curious. It's a very specific set of questions that are, again, have been adopted by the CDC and nationwide. We'll go through that algorithm pretty much and determine whether or not you need a test. And we're trying to reserve those tests for people who are likely to suffer or need to be admitted to the hospital.
Gotcha. And County Chairman, you kind of mentioned how funeral services are going to continue. Do we know how many people were at the funeral services for these past two that have been at a greater risk?
We don't know I don't know the answer to that. We do know that there were a significant number of people that were present, that there was a common thread at these two separate funerals, that heavy presence from Gethsemane Worship Center as well as New Direction Christian Church, and also a common connection with M.L. King Funeral Home. And so those are the connections that we're trying to arrive at and trying to investigate and trying to get that information so that we can best enable our citizens to be able to exercise precaution and care in how not only they care for themselves, but how they also do not expose others.
Gotcha. And with the drive-through service that happened yesterday, this might be a question for one of the representatives to answer. How was that process? I believe we tested, was it 78 people?
Yeah, so we set up the phone line, right? This is the phone line, and we ask everybody to call this number first. And then based on that screening, we had 78 people that based on that phone screening, we asked to come by the drive-through to actually be tested. So we're awaiting those results.
Are they all back at home now, or?
Yeah, none needed admission.
Has anyone that has been hospitalized recovered from this yet? Just going about their normal days?
Yeah.
Yes, yes. I will tell you, out of the 8 positive COVID-19 tests that we have, 3 of those patients were discharged. We're contacting them every day, to make sure that they're not showing any evidence of having a relapse. And my understanding is all 3 are doing well at home at this point.
How long was their recovery time?
I think that's truly going to vary by the individual. It's certainly their age, their underlying medical status, whether they have any pre-existing lung disease or chronic underlying medical conditions, as well as the severity of their illness when they did contract COVID-19. So that's really something that's a little hard to predict, but generally speaking, 2 to 4 weeks.
To protect our first responders, can you guys maybe reiterate when to call 911? Is there any screening that you're doing before you go on sites?
I'd like to give you an opportunity to come up and address these questions.
Yes, good afternoon. We do have a process that if you call 911, we have certain questions that the dispatchers are asking, and if there's a hit on any of those, they are forwarding the information to the appropriate agency that is responding. So we do take all precautions. Some of the times we get there, the information moves us into a more area where we're being more protective. But then again, some of the information we get, we can confirm that it might not possibly be. So we do go in with N95 mask on all the medics. We're wearing eye protection, proper PPEs, what we call protection on all calls now. So this is standard for every medical call. If you see an ambulance crew come in, don't be frightened because they're wearing their mask. It's for your protection and their protection. So we want everybody to know that if we're transporting to the hospital, we are going to put a surgical mask on you. Again, it's for your protection. The ambulances are being deconned after every call, and we have additional cleaning methods to ensure that the ambulances stay clean.
Is there a curfew that we're enforcing in Dougherty County?
We do not have a curfew in Dougherty County at this time. And by the way, that was Sam Allen. He's director of Dougherty County EMS.
Gotcha. So with all the kids being out for this extended spring break, so we're not going to enforce any stay indoors at this time type of protection?
Please.
And there is an existing ordinance in the city of Albany that deals with curfew for kids that are school age, that they have to be home at a certain time. As far as sort of I think what you're referencing, more of a curfew that's associated with certain disasters. One, I'll say this, they're incredibly difficult to manage. Two, sometimes it actually creates more problems than good. And the 3, I mean, you also have a lot of kids that are at home now at different times than they normally would be, and parents that are under stress with respect to jobs and child care and trying to figure that out. So it's not something that's been deemed appropriate at this time for us to enforce or seek to enforce. What we're doing is we're putting the information out there and providing, whether or not someone's out at day or night doesn't really affect whether or not you get the coronavirus. It's really just trying to stay in and stay at home.
I heard on the drive over that Florida is closing restaurants and bars as of, I think, 5 p.m. tonight. Is anything like that on the horizon in Georgia?
That's something we're evaluating right now.
Would that be a statewide thing, or I know restaurants are having people just come through drive-throughs, or
I think what you're seeing already within the private industry with Starbucks and other places that they are sort of absorbing that anxiety that the coronavirus is creating. Obviously, that's something that we're going to evaluate as a community. We're constantly in contact with our state, local, and federal partners regarding best practices. In fact, I've got a phone conference this afternoon with the governor's office. We're going to be communicating with our counterparts at the Georgia Emergency Management Agency. And so may that become a talking point in the future? Absolutely. Is it today? No. Is it something that we're saying it won't happen? Absolutely not. This is a dynamic process, and we've got to evaluate, each thing as we come to it.
Do any of you guys know why it's so significant in Dougherty County? Is there any specific reason to that?
I believe the principal determinant of why we began within a relatively short period of time to see a significant influx, like I said, was the fact that overwhelmingly the predominant method of transmission is community, okay? And as we alluded to, you had two local gatherings that put a lot of people together in a relatively short place, and all it takes is one, what we call an index case, and when you take something that's highly communicable, highly transmissible, average incubation period is about 5 days. So you kind of march that out. It doesn't take long before you really begin to see the impact of that in a community, and I think that's probably the principal determinant, apart from Metro Atlanta, why we began to see a cluster of cases here.
And have we had any other confirmed deaths so far related to the coronavirus here in Dougherty County?
No. Very good. Thank y'all.
All right, next press conference will be tomorrow at 1 p.m. And we'll assemble a panelists for your questions at that time. Thank you.